In and around 1999, Americans began consuming prescription pain medications at an increasing rate. Between 1999 and 2012, the number of prescriptions written for pain medication tripled. Doctors were fairly unaware of the ramifications and were prescribing them as a solution to our varying degrees of pain. I, too, was oblivious to the lurking danger and the resulting destruction that would befall me, my family, and our country. My name is Phillips. I'm the mother of 3 children, Brian, age 27, Audrey, age 18, and Aaron, permanently age 20, taken by an overdose from opioids in 2013. From ashes we rise. I am a phoenix. This is my story of rising from losing my middle child to a preventable cause, and my efforts to lift others out of this inferno. Fires, infernos sweep through structures quick and without warning, often when we least expect it, are ignoring the warning signs, and sleeping. This is the reality of what addiction and opioid use disorder has done to me, my family, and the entire country. My version of sleeping consisted of focusing too much on how I would be judged as a parent, as a daughter, as an educated member of society, instead of focusing on the possible dis-ease and the symptoms that would be engulfing my son. In the United States, 22 million people are affected by the chronic disease of addiction each year. This is 7% of the entire United States population. Breast cancer affects 2 million each year, less than 1% of the world's population. Yet we don't focus treatment and resources and invest thousands of dollars towards the chronic disease of addiction. We don't wear ribbons and sports team apparel in our assigned color. Instead, we hide in the corners with shame and denial. My shame and denial, my decision to sleep and hide took many forms. While I casually mentioned to Aaron the concern I had with the pills that I found in his room, I would not do any research on the trends affecting today's youth. I wouldn't ask a physician about the possibility that my son had been affected by a prescription. When it would become more obvious that Aaron was suffering from misuse of prescriptions and something was really wrong, the illogical behaviors he had as a manifestation of substance abuse, theft from family, guns and regular activity in dangerous neighborhoods, falling asleep on the job, and violence towards his mother, I would do relatively nothing. I would speak to his father and other influential men in his life. I would listen to them tell me that there wasn't enough money. I would buy the argument that treatment might not work. So why is this relevant? Because if Aaron had had another chronic disease, I would have gone to doctors, spent all the money I could find, and gone to the ends of the earth to treat my sick child. There was a day Aaron pled with his head in his hands for help. Yet a sense of urgency would be absent, and the disease would win on October the 9th, 2013, 5 years ago this week. I knew then that I would have to see what could have been done differently. Acknowledge out loud how much the stigma and denial cost me and my family, and take immediate action so others might live. So every day I choose to rise up from my ashes and be Aaron's voice, to normalize this disease, help save others, and make a difference. I either have to rise up or simply disappear into the sidewalk cracks. So I'm going to reveal my scars, show you my cracks and shame so I can save others. Human beings, we're wired to have connection and find meaning and purpose. I know I've been seeking my meaning and purpose my entire existence. So there must be some meaning behind Aaron's presence in my life and now Aaron's absence. Otherwise, how do I survive? What's the lesson? Where is the why? What can we allow ourselves to learn from tragedy and loss? Is there a possibility for a silver lining? A wise spiritual advisor said to me, "Find the golden thread, Justin. Even if the golden thread is the whiskers on the mouse that lives in your wall." I personally do not want to think a mouse whiskers are cute. But I do want to find beauty in this pile of ash. In Greek mythology, the phoenix is a bird that regularly regenerates itself. It obtains new life from arising from the ashes of its predecessor. Aaron would want nothing more than for me, his brother and sister, to rise from the ash and find a new life. Not a better life, not a life where Aaron is forgotten, but a life that takes tragedy and creates from it a new life from the destruction. So in 2014, I formed Overdose Lifeline. We are a nonprofit with the sole aim of helping others, just like me, better understand the swift nature of this insidious disease and the certain death sentence that comes from opioid misuse. We have been on the front lines ever since, speaking out and advocating for families, allowing for better access to the overdose reversal drug naloxone, and educating individuals, parents, communities on the relationship between prescription pain medication, heroin, and opioid misuse. My most important work is with and for other families just like mine. Grief and loss is so misunderstood and also stigmatized. Our suffering, our broken hearts can never be repaired, but I can use my broken heart and relate to your broken heart and help others see us. All we want is to be seen. I have learned so much about grief, and I continue to learn. I understand a lot of people who've never experienced grief don't really know how to handle it. I live my grief out loud, here today, on social media, and as an active part of my work. But exposing grief, loss, which is the greatest form of hurt, is helping healing, because a wound cannot heal without exposure to air and light. I would give anything to have Aaron back in the flesh, but from Aaron's loss, I have been given so many gifts. I know people I would have never known. I get to be with you today. I know myself in ways I never would have known. I get a faith, a power greater than myself. I have the privilege of helping other people save their children. I have the privilege of making a lasting impact. My reality today often resembles a dreamlike state, or perhaps on occasion on the edge of nightmare. Sidewalk cracks and consideration of self-destruction are often on the edges of my path, I'm not going to lie. We can never expect this generation of families affected by the opioid public health crisis. We lost 72,000 people in 2017. That's a lot of families left alive in this destruction. Never expect us to be better or whole or over it. Instead, just see us, acknowledge us, and say our loved one's name. Do not pity us, but instead just know we are now a different person, never to be that person we were before. It's hard to explain. We don't want your pity, but we do want you to see us and understand us. Our hearts may be broken, but they have been broken open, and this is where the light gets to shine through. Thank you very much.